Shocking drug abuse transformations. Amy Thompson. It is a jarring contrast to see pictures of Scottish teenager Amy Thompson before and after that fateful June night when she incurred brain damage upon taking an ecstasy pill. Beforehand, the glamorized 16-year-old looked flashy, well-dressed, and well, like your typical fashion-oriented teenager. Now, a video recently posted to Facebook shows a wheelchair-bound and pallid-looking Amy unable to move her arms while heavily slurring her speech. She was reportedly admitted to a Glasgow hospital after taking a crystal capsule of MDMA at a house party, at which time she was put into a medically induced coma for several weeks. Adora. This rapid 5-year regression of Adora from age 48 to 53 demonstrates the impact of what is known as meth mouth. Here, the meth addiction has brought on a dramatic level of decay and grinding, leading to a rather grotesque loss of teeth and a woman who appears to have aged far more than just 5 years. The galling effects of the drugs have also taken their toll on her unkempt, greasy hair, her stained, ashen skin, and through the bruising, scratch marks, and skin damage that can be seen all across the left side of her face and along her forehead. Female, 25. The presence of a hideous, widespread rash of red bumps across this woman's face points to what is likely an addiction to an opiate like Oxycontin or heroin. While she otherwise looks, for the most part, like a normal 20-something female, the red bumps highlight the multifaceted effects the drug can have. If you can look past her irritated skin, you will notice that her previously full, fleshy face has grown gaunt and narrow. Her stringy, greasy hair also suggests a lack of proper emphasis on normal hygiene. Male, 25. Given the reddened flesh and burn-like skin tone of this meth addict, it seems reasonable to assume that drug abuse has left its mark through sores and scarring. It is common for meth users to hallucinate while on the drug, with a sensory feeling of bugs under the skin being particularly typical. Perhaps then this young man incurred a brought-on self-mutilation by his obsessive scratching while on meth. Meth mouth is also clearly visible here, with swelling and redness circling his mouth and his teeth becoming increasingly yellow. Female, 43. It's unknown what circumstances occurred that led to this woman ultimately getting that creepy glass eye, but chances are you probably don't want to know that story. Plus, there is plenty else to focus on to highlight the extent of her addiction, what with a sunken chest that showcases her collarbone, and some pronounced wrinkles that make her after picture look far older than the 10 years that separate her from her before picture. Her face also reveals some pockmarks and a somewhat mangled forehead. But let's be honest, it's the glass eye, one that clearly wasn't there 10 years earlier, that stands